Hi there, Jane community. My name is Dr. Emma Furze, and I am a naturopathic physician and aesthetic injector located in Maple Ridge, BC, and I'm a proud Jane ambassador. Today, I'm going to take you through the template library and show you some of my pre-made templates that make my charting life a lot easier. So the first thing you're going to do is head to your staff profile by clicking staff and your name on the left-hand side. Then click on the templates tab, and we can explore the library. So if you're new to Jane, this is a great place to start. Rather than reinventing the wheel, there's probably going to be something out there that's already been done. So say you are an injector that does cosmetics. If you type cosmetic, you're most likely going to see some pre-made templates already done here for you, which you can click on, take a look at, and see if you like. If you don't even know where to start, you can search your discipline. So if you're in aesthetics, click here, and then there's a lot that come up. Feel free to click, browse, and see what you like. If there is one that appeals to you, you just click this blue add button and then you can further edit it. I'm going to show you some that I already have done that I've shared here. So like I said, I am an injector as well. I have a cosmetic template that I've made. So we start off with some basic questions in the subjective area. These are what we call check boxes with notes. This is a simple note box. These are just check boxes. And I like checkboxes a lot because it allows you to ask questions but then not have to type them out again. Just check the boxes as you go down. For this type of template, I'm also going to be charting using an iPad. I just find it easier for any sort of injectable patients, whereas in my naturopathic practice, I'm usually using a laptop. We'll see why the iPad comes in handy just shortly here, but asking about allergies, medications, supplements, etc. We have our objective and assessment, and then we get into the plan. So I've pre-populated this with using Nuceiva. I will change this as, the lot and expiry, changes when I get a new shipment. I can also change this if I am using a different product as well. Again, we see these checkboxes come in really handy here. And this is really why I like using an iPad, because I'm able to draw on this face, and you can change the image if you'd like for your own, but I like this simple face. And then I can use my iPad pencil to just draw on each spot where I would add different units. Then we just have some basic instructions. Again, just check marks. I really like these. I can, check the boxes as I'm telling the patient what to do. And then follow up. So if I see them in 2 weeks, great. 3 months, we'll go from there. I'm just going to save this and show you the next one. I also do a lot of IV therapy. So again, this template starts with our subjective area. We can just ask the patient any questions, basic updates, always doing a safety screen, making sure none of those are a problem for us. Objective, this is also a good chance where I remind myself to do pre and post IV vitals. So I've added in this little vital section, which comes in super handy. We're going to do an assessment and then our plan. So I've also customized this. These are the different types of fluid bags I can use. Again, from a drop-down menu, it's nice just to be able to select the one. I could do this as a checkbox too, but I like the drop-down for this. And then for the IV constituents, these are a lot of pre-made formulas I have. Again, in a chart, they can be customized and edited. So if I add a different ingredient or, change the number of cc's of something, that's easy to be changed. And then I will always fill in the volume and osmolarity as well. So these are just some pre-made ones I have. And obviously, whichever one I don't do, I'll just delete. Needle type again, which type of catheter I'm going to use, admin site. So these options on a drop down can also be changed as you need. And then again, just some pre-made things upon discharging and progress notes, which can be changed as I need for each patient as well. My naturopathic initial visit is quite a long template because this visit is just about an hour. So I have some room first in the subjective pre-made for different concerns and history about those. I'll always ask about energy, sleep, markers of health, basic past medical history. These are what we call checkbox with notes, which I like because you can check off medications and then write them all out. Social history. I do a lot of women's health, menopause, fertility, that kind of thing. So this is very important. Nutrition and digestion, family medical history, review of systems. So we go all the way down here. And then in the objective area, again, sort of pre-populated that. I can change it if they are not alert and orientated. Take their vitals, any PE that I have to do. Assessment, we just have some open boxes to do that. And then we go into our plan. So when I need to see them next, make sure consent's obtained, and then future plan. So whatever type of things we need to do in the future. And the last one I'm going to show you here is a prescription. So this is a really important template. I probably use this multiple times a day. What I've done here is I've sort of pre-populated it with 2 different medication options, and these can be easily changed. So all I do in an actual chart is cross out the name and write whatever the medication is, quantity, duration, sig, refills. So that's super easy, already done for me. And then if I only do one, I can just delete this second part of the template. If generic's not okay, again, I'll just remove that. So this makes prescribing a lot easier in Jane. I then just sign it as a chart template, export it as a PDF, and e-fax it over to their pharmacy or print it off if they're there. Prescribing, I also do a lot of hormone therapy, so I do have a different template for that as well, with just a lot more pre-populated options. But the main idea here is that the template library saves you a lot of time. You can have as many templates as you need. I probably have about 15 turned on in my account that really just make things a lot easier and simpler. And I'm always changing them and updating them as I need them. Sometimes I do a template and I think it's really good, and then I go to actually chart for a patient and I don't like something about it. So what's nice is that they're ever evolving and can be edited. And I hope you found this helpful, and have a great rest of your day.